In Ghana today, there's a serious health challenge bubbling up, and it's hitting the country's young people the hardest. We're going to dive into what's being called a hidden epidemic, one that's putting a whole generation at risk. Okay, let's start with a number, 7.1%. What is that? Well, that's the estimated HIV prevalence among adolescents and young adults in Ghana. It's a number that, honestly, points to a crisis that's unfolding almost silently among the country's youth. Now, here's where that number gets really, really concerning. You see, that 7.1% for young people is more than 4 times higher than Ghana's national adult average, which sits at just 1.7%. That is a huge gap, and it tells us that young people are shouldering a much, much heavier burden of this epidemic. So, if we zoom out for a second, you can see this isn't just happening in a vacuum. The data shows that the vast, vast majority of young people living with HIV are in sub-Saharan Africa. So, while Ghana's situation has its own unique local causes, it's really happening right at the epicenter of this massive regional challenge. Okay, so what's driving these high infection rates? Well, one of the key factors seems to be a real shift in priorities. It turns out young people are often more focused on preventing pregnancy. This means things like emergency contraceptives are on the rise, but condom use, which protects against STIs like HIV, is actually going down. That right there raises a huge question. If prevention is already this tricky, what about just getting a diagnosis? Let's take a look at the roadblocks that are stopping young people from even getting tested in the first place. And that's really the heart of the matter, isn't it? A recent study dug into this exact question, focusing on one specific area, Ghana's Asutifi North District. And what they uncovered reveals some really profound, very human barriers to getting healthcare. And the results were, wow, they were just so clear. Every single young person they interviewed, 100%, said that poor attitudes from healthcare workers were a major barrier. And if that wasn't enough, over 70% also pointed to the powerful cocktail of fear, stigma, and discrimination. The researchers themselves put it perfectly. They concluded that this stigma, this discrimination, it's not just a feeling. It actively creates an environment of shame that literally pushes young people away from the services they desperately need to know their status and stay healthy. And this stigma, it's not some abstract idea. It has a real, tangible cost with incredibly damaging consequences for the mental and physical health of these young people. Yeah, the research really shines a light on the heavy mental health toll. Studies show that young people in Ghana living with HIV often grapple with serious psychological distress. We're talking depression, anxiety, and this deep internalized stigma that can lead to just completely isolating themselves. And that distress creates this huge ripple effect, right? It impacts everything. It makes it harder to stick with their treatment, it makes it harder to connect with friends and family, and it can even affect whether or not they can stay in school. The end result of all this is what you see here. A really dangerous gap in what's called the treatment cascade. Just look at this difference. For adults with HIV, 87% know their status. But for kids, that number plummets to just 66%. They're so much less likely to even get a diagnosis, let alone start the treatment that could save their lives. But, this isn't just a story about challenges and barriers, not at all. On the ground, communities are fighting back, and they're doing it with some really innovative, culturally specific solutions. Let's dig into how culture itself is becoming a powerful part of the cure. Okay, so in rural Ghana, health workers are tapping into this amazing local tradition called the community darbar. Now, this is a traditional gathering of chiefs, elders, and the whole community. But here's the brilliant part. It's being repurposed as this vibrant, powerful platform for health education. So how does it actually work? Well, it's a multi-step process. First, health workers team up with the local chiefs, who are deeply respected, to give the health message instant credibility. Then, they mix that education with tradition, so you'll have things like cultural performances, dance, and music right alongside information about HIV. The whole thing just builds this incredible sense of community trust and creates a safe space for dialogue, which really helps break down the stigma. And what's so cool is when you compare this approach to the old way of doing things, that top-down method, like sending out an announcement van. Those often just don't work in rural areas. The messages feel impersonal, and people just ignore them. But this community-up approach, using the Durbars, it's way more effective because it taps into trusted leaders and cultural norms to make sure the message actually lands. And that community-led spirit goes even further. We're also seeing programs that train young people to become adolescent health champions. Think of them as peer educators, sharing crucial health info directly with their friends in their own circles.
All of this community action, it really points to a fundamental shift in how we need to think about the HIV response. It's about putting young people right on the front line of their own solution.
And here's the absolute key takeaway. For any of this to work, young people can't just be the focus of the programs. They have to be essential leaders and partners in creating them from the ground up. It was put so well by youth advocate Abdul Fattah Salifu. He said, "Young people must be more than just recipients of services. We must be active, empowered partners." And that's it, right there. The whole model has to change from just asking for opinions to truly co-creating solutions. So the question isn't just, how do we reach young people anymore? It's, how do we empower them to lead the way?